Patients and Family Rights chapter is reviewed by all surveyors. We will focus here on those addressed by the LD surveyor. Patients and Family Rights chapter is a hospital-wide chapter that requires patients and their families are treated with dignity and respect in all aspects of their being when receiving care. The chapter also focuses on patients' involvement and the freedom to exercise his rights. PFR 1 Leadership Support and Protection of Patient and Family Rights. To ensure compliance with PFR 1, we review the scope of services of the Patient Relation Department and the term of references of the Patient Advocacy or Patient Rights Committee. We review the policy that outlines the patient and family rights and responsibilities with clear staff roles to ensure implementation. PFR 1.4 relates to the availability of policies addressing standards found in this chapter. We observe the availability of posters and handbooks containing PFR statement. General consent form may contain a paragraph or a clause indicating patient awareness of his rights and responsibilities. PFR-related orientation and training are included in the General Orientation Program, as well as in the Annual Education and Training Calendar or in a separate schedule. We interview staff to ensure their comprehension of PFR-related policies and how they respect them during their daily work. PFR 2 focuses on respect and support for cultural, psychosocial, religious, and spiritual needs of the patient. To evaluate compliance to PFR 2, we review training schedules, we observe hospital facilities such as waiting areas or shared patient rooms. We also interview staff to confirm their awareness on how to facilitate for spiritual support when requested. Supervisory staff are interviewed regarding handling complaints concerning staff attitude and behavior. PFR 5 Protection for Patients. To ensure compliance with this standard, we observe staff-patient interactions when we visit the outpatient or the emergency room. We observe the security measures taken in the nursery, NICU, geriatrics, and female wards if available. Volunteers, contractors, trainees, and parents of NICU infants should be identified with badges. We interview staff regarding their infant abduction or the Code Pink policy. PFR 8 Patient and Family Participation in Decisions Regarding the Care Process and Treatment. PFR 8 is related to PFR 9, 10, and 11. We interview staff in different areas, especially in the surgical unit, to inquire about the hospital inclusion of patients in the care process, how it ensures patients freedom to ask questions prior to a procedure or treatment, and how information is made accessible to them through pamphlets or other means. Patients may be interviewed to verify their awareness of their rights and of their care team, as well as their involvement in the care plan. During inpatient or social worker unit visit, staff are interviewed regarding how they facilitate patient access to second opinion and how patient preferences are respected and provided. PFR 10 Informed Consent Process. Compliance to PFR 10 includes availability of informed consent policy and forms. The policy should define what is an informed consent process. PFR 10.3 and 10.4 require that the informed consent policy contains a list of procedures that mandate an implementation of the informed consent process. Compliance to PFR 10 is verified by medical and nursing surveyors through their visit to the operating room and post-surgical care areas. However, the policy we review must include who is legally allowed to consent for patient when he or she is unable to consent for himself. PFR 16 Clinical Research System. To ensure protection of patients participating in clinical trials, a process based on Code of Ethics should be present in a form of a policy and should be strictly implemented. The process must be closely controlled and monitored through a hospital's research or ethics committee. Informed consent process must be implemented and documented. Patients involved in clinical research may be interviewed to ensure their awareness of their rights and that their wishes to withdraw are respected. In cases that clinical research is not within the hospital scope of services, this must be defined and stated clearly in a policy to ensure that there are no violations within the hospital premises. PFR 17 Ethical Standards. The hospital needs to establish an ethical framework that guides its care providers during ethical dilemma. This may include a formation of a committee of senior staff members or clear process flow to handle such situations. The hospital should have an approved price list available for staff to bill patients accurately and to respond to relevant inquiries. The scope of services or list of services should be available for the public at entrances and in the hospital website if it has one. Hospitals must have a clear process on how patients in emergencies are cared for regardless of their inability to pay. Hospitals need to keep track of all issues and outcomes of ethical considerations and take improvement actions accordingly.